Hello everyone, this is Tania. Welcome back to our channel. So today we will discuss about the another important vital parameter, that is respiratory rate. Okay, so we will do MCQ about the normal respiratory rate and what are the abnormality, mainly the abnormality of the respiratory rate. What are the so let's start today's session. So first of all, what is respiration? Respiration is the exchange of gas between the atmosphere and the blood. It mainly includes the three processes: ventilation, perfusion, diffusion and perfusion. So what is ventilation? Ventilation is the exchange of the gases, means into and out of the gas or from the alveoli. And what is diffusion? Diffusion is the passive movement of the gas, that is oxygen and carbon dioxide, between this alveoli and the blood vessel, means blood. So diffusion, that is the movement of the air or gases between the alveoli and the blood. And what is perfusion? Perfusion is the circulation of the blood through the pulmonary capillary. So through pulmonary capillary, through this capillary, the circulation of blood known as the perfusion. So what is inspiration? Inspiration is an active process, whereas expiration is a passive process. The normal respiratory rate we all know, that is 12 to 20 breaths per minute. Now there is a first question. What does the term orthopnea refer to? Increased rate, option A, that is increased rate and depth of the breathing over a prolonged period of time. Option B, breathing difficulty when lying down flat. Option C, gradual increase in the volume and frequency. Option D, normal breathing. So what is the right answer? Yes, this is the breathing difficulty when lying down flat. So, in orthopnea, the client came with the symptom that he or she having the breathing difficulty when lying down, and the breathing difficulty resolve when he or she stand up. Okay. Now we will learn about the respiratory abnormality. So what are they? The normal breathing, that is also known as eupnea, ever the bradypnea and the tachypnea. What is bradypnea? Brady means decrease. So when the respiratory rate decrease less than 10 breaths per minute, it is known as the bradypnea. And what is tachypnea? When the respiratory rate increases more than 20 breaths per minute, it is known as the tachypnea. And what is hyperpnea? Hyperpnea that mainly seen in the time after exercise. Okay, so when there is a increase the depth and the rate of the respiration, so that is the hyperpnea, and it mainly seen in the at the after exercise. There is a increased depth and the rate of the respiration. So this is the hyperpnea. Now the next one, that is the what is apnea. Apnea means the cessation, means the temporary cessation of the respiration for several seconds. Okay. The next one, hyperventilation. Hyperventilation means the hyperventilation, that is the respiration rate and the depth of the respiration increases. In this, there is the hyper means increase the intake of the oxygen and the blowing of the carbon dioxide, both increases. So this is the hyperventilation. And what is hypoventilation? Hypoventilation, in this the rate of the ventilation entering the lung is insufficient for metabolic needs. So respiratory rate is below normal and depth of the ventilation is depressed. So there is a decreased oxygen intake and carbon dioxide exhalation. So that is the opposite of the hyperventilation. The next one, that is the main important, the four, chain stroke respiration. So what is chain stroke respiration? That also known as the waning and the waxing of the respiration, means that there is the irregular and characterized by the period of apnea and hyperventilation. Okay, so what happened in this, there is a slow shallow respiration, then gradually the slow shallow respiration increases in hyperapnea, again there is a apnea, and again the slow shallow respiration, again hyperapnea. So this is the chain stroke respiration. So in this there is written, the respiratory cycle begin with the slow shallow breath that gradually increase to abnormally depth and rapidity. The gradually breathing slow down and become shallower, means there is a slow shallow breathing, then again the increased depth and the rapidity, then again slow down. So this is the chain stroke respiration. Now the Kussmaul respiration. Kussmaul respiration is mainly seen at the diabetic ketoacidosis. It is very important question. Okay, so in diabetic ketoacidosis case, we see the Kussmaul breathing. So it is the, remember that it is regular and it seem to hyperventilation, means there is a increased depth, increased rate and depth of the ventilation, but it is the seen mainly in the diabetic ketoacidosis patient. And what is dyspnea? We all know that difficulty in breathing. Yes. Orthopnea. Yes, we have done the MCQ of orthopnea. Now the Biot spots. Biot's respiration or the Biot spot. So in this there is the shallow breathing interrupted by an irregular period of apnea. So in Biot's respiration there is a slow shallow breathing with a period of apnea. Okay. Okay. Now the respiration which is abnormally shallow for 2 or 3 breaths followed by irregular period of apnea is termed as abnormally shallow for 2 or 3 breaths followed by irregular period of apnea. It is known as the Biot's respiration. Okay, we all know, we already learned that, discussed that there is the abnormally shallow for 2 to 3 breath hobe, then there is the period of apnea. Okay, so this question, that the rhythming, waxing and the warning, during discussion I have told that this is the chain stroke respiration. Next, the feature of the Kussmaul respiration are respiration ceases for more than 20 seconds, regular but abnormally slow respiration, labored respiration with increased rate, abnormally deep, regular with increased. What will be the answer? Yes, abnormally deep and regular with increased respiratory rate. There will be increased respiratory rate. The lack of oxygen in the bloodstream. The lack of oxygen in the bloodstream, that is known as hypoxia, anoxemia, hypoxemia or cyanosis. It is known as the hypoxemia. And in the bloodstream, and if it is lack of oxygen in the tissue, it is known as the hypoxia. And anoxemia, that is the absence of the oxygen in the bloodstream. And hypoxemia already told, and cyanosis, that is the bluish discoloration. Bluish discoloration. Now there is the graph of the respiratory abnormality. This is the eupnea and bradypnea, that is the slow rate. We already discussed, only just see this graph. Sighing, frequent sigh interspent with the regular breathing and the causes are like dyspnea, anxiety. See the Biot spot, that the slow shallow respiration with the period of apnea. Meningitis, brainstem damage, in that cases we see the Biot spot. Then the chain stroke respiration, in which cases we see the chain stroke respiration. Kussmaul breathing, that is the abnormal but regular breathing and deep breathing. Diabetic ketoacidosis and central sleep apnea. In heart failure, in kidney failure, we see the central sleep apnea. Okay. So do you have any doubt about this respiratory abnormality? Okay, so thank you. If you have any doubt, so just comment below, and thank you everyone for this session.